What if I told you that some of the medical tests you've always trusted after turning 70 could actually be doing more harm than good? Today, we're going to uncover the hidden risks behind routine screenings and why the advice you've been following might not be as safe as you think. Even more unsettling, what if, in some cases, those same tests could unintentionally introduce risks that no one has fully explained to you? For many people, this idea feels uncomfortable because we've been conditioned to believe that more screening automatically means more safety. From a young age, we're told that catching problems early is always smart, that following every guideline is the responsible thing to do. And in many cases, that belief holds true. Early detection has saved countless lives, and preventive care is undeniably valuable. But what few people discuss is that as we age, particularly past 70, the rules begin to shift in subtle ways. These shifts are not dramatic, nor do they happen overnight, but their consequences can be profound if you are unaware. My name is Dr. Adam Smith. I've practiced internal and geriatric medicine for over 2 decades, working closely with patients in their 70s, 80s, and beyond. Over the years, I've had the privilege of witnessing what truly supports healthy aging, not just in theory, but in the day-to-day lives of real people. I've seen individuals remain independent, mentally sharp, and physically active well into their 90s. Yet I've also witnessed something that isn't talked about enough. I've seen people who were doing perfectly fine walk into routine medical appointments and leave on a trajectory that changed their life. Not because they were sick, but because a series of well-intentioned decisions set off a cascade of events. A test led to another test, which led to a procedure, which led to complications. Before they realized it, their quality of life had shifted in ways they never expected. If you've ever gone to a doctor feeling completely healthy and left feeling uncertain, anxious, or worried, then you already know how powerful this shift can be. That moment, when you start to question your own health even in the absence of symptoms, is often where this entire process begins. Modern medicine doesn't just respond to illness. It actively searches for potential problems. And sometimes, it continues searching even when there is nothing meaningful to find. Within the medical community, there's an ongoing discussion that most patients never hear about. Are we sometimes doing too much, particularly for older adults? Certain tests have become so routine that they are rarely questioned anymore. Once you reach a certain age, they are presented almost automatically, as if they are simply the next step you are expected to take. To understand why this matters, let's consider a very common scenario. Mr. Samuel Green, 73, walks into a clinic for a routine checkup. He feels well. He's active, independent, and manages his daily life without major issues. He expects a standard visit, perhaps a few routine discussions, and then to go home. But by the end of the appointment, he's handed a list of recommended tests, a colonoscopy, a prostate screening, and a cardiac evaluation. Even though nothing has changed physically, his perception shifts. Suddenly, he wonders if something might be wrong. That shift, from feeling healthy to feeling like a potential patient, is one of the most powerful psychological effects of modern healthcare, and it often happens without us even realizing it. Screening tests are designed to detect diseases early, often before symptoms appear. In younger adults, this approach can be highly valuable. There is enough time for early detection to significantly impact outcomes, and the body is more resilient, able to handle procedures and recover quickly. But after 70, several critical factors begin to change. Many diseases, especially certain cancers, develop more slowly in older adults. Life expectancy becomes highly individualized. Two people at the same age may have very different health trajectories. And most importantly, the body becomes less tolerant of stress, whether that stress comes from invasive procedures, anesthesia, or recovery itself. When you combine these factors, the balance between potential benefit and risk begins to shift in a meaningful way. A colonoscopy, for instance, has long been considered one of the most effective tools for detecting colorectal cancer. In the right context, it is invaluable, identifying early signs of disease and even preventing cancer by removing precancerous growths. But after 75, the risk-benefit calculation becomes more complex. Even the preparation for the procedure, clearing the digestive system, can be physically demanding. It often leads to dehydration and electrolyte imbalances. While this may be uncomfortable but manageable for younger adults, It can place significant stress on older individuals, sometimes resulting in dizziness, weakness, or even hospitalization. Then comes the procedure itself, which carries its own set of risks. Complications such as bleeding or bowel perforation, though relatively rare, increase with age. Sedation, commonly used during colonoscopy, places additional strain on the cardiovascular system, which may not tolerate it as well as it once did. Large-scale studies published in leading medical journals have examined outcomes of routine colonoscopy in older adults. They found that for many individuals over 75, these procedures did not significantly extend life expectancy. In other words, there was no clear survival benefit for routine screening at this age. At the same time, the likelihood of complications requiring hospitalization was higher. This creates a situation where the potential risks may outweigh the potential benefits, particularly for older adults who are otherwise healthy and not experiencing symptoms. Yet despite this evidence, many patients are still encouraged to undergo routine colonoscopies simply because the procedure has become part of standard practice. The reason this happens is not malice or neglect. Healthcare providers generally have the best intentions and adhere to established guidelines. But the system often emphasizes routine and consistency over personalization. Patients may not always receive the full context needed to make truly informed decisions. This is where awareness becomes essential. By understanding how these decisions are made, you can begin asking better questions, moving from blindly following recommendations to actively participating in your own healthcare choices. And this brings us to the next topic, prostate cancer screening using the PSA test. At first glance, this test seems straightforward, but in older men, it can trigger a cascade of events with serious implications. The PSA test measures prostate-specific antigen in the blood. Elevated levels can indicate prostate cancer, but they can also be influenced by benign conditions such as inflammation, infection, or prostate enlargement. In younger men, early detection of aggressive cancers can be life-saving. But once a man reaches 70 or older, the situation changes dramatically. Research shows that many men at this age already have prostate cancer cells, yet the vast majority of these cancers are slow-growing and unlikely to affect health or lifespan. When a PSA test is abnormal in a 70-plus-year-old man, it often triggers further investigations, repeated blood tests, imaging such as MRI, and sometimes biopsies. While these steps may seem prudent, each carries risks, pain, bleeding, infection, and significant emotional stress. A confirmed diagnosis may lead to surgery, radiation, or hormone therapy, each with potential side effects. Surgery can cause incontinence or erectile dysfunction. Radiation can bring fatigue and bladder or bowel irritation, and hormone therapy can affect mood, energy, and bone density. Ironically, in many cases, the intervention may cause more harm than the disease itself. This phenomenon, known as overdiagnosis and overtreatment, is one of the most misunderstood issues in modern medicine. Many patients assume that detecting a condition is inherently beneficial without realizing that context, age, overall health, and disease progression is crucial. While colonoscopy and PSA testing illustrate how routine screenings can shift risk-benefit calculations with age, cardiac stress testing shows another dimension of this phenomenon. Cardiovascular disease is a leading cause of mortality worldwide, so it's natural to think that testing the heart proactively is always beneficial. However, aggressive cardiac stress testing in asymptomatic older adults, those with no chest pain, no shortness of breath, and no history of heart disease, can sometimes lead to more harm than good. The very act of testing can initiate a cascade of interventions that may not improve outcomes. Take the case of Mr. Leonard Harris, 78, an active retiree who spent his mornings walking through the park and his afternoons gardening. Leonard's previous physician recommended a cardiac stress test during a routine checkup. He felt healthy and had no symptoms, but the test results suggested a potential abnormality. What followed was a series of additional procedures, echocardiograms, coronary angiography, and eventually, stent placement. Each step carried inherent risks: bleeding, infection, procedural complications, and the stress of multiple hospital visits. Leonard's life, once filled with simple joys and independence, became dominated by doctor appointments and medications. His experience illustrates the cascade of care that can occur when screening is done without considering individual context. False positives are common in cardiac testing. Even when initial results suggest an issue, further investigations often reveal that no significant problem exists. Yet the psychological impact, anxiety, sleep disruption, and fear can be substantial. Meanwhile, the systemic pressure to act is powerful. Physicians, guided by protocols and concerned about liability, may feel compelled to recommend interventions. Patients, fearing that inaction equals negligence, often consent to treatments they might not have chosen if they fully understood the risks and benefits. Research shows that in older adults without symptoms, aggressive interventions such as stent placement or bypass surgery often do not improve survival compared to conservative approaches like lifestyle modification, medications, and regular monitoring. To better understand the personal impact of these decisions, let's consider another patient story. Mrs. Eleanor Finch, 75, came to me after a series of medical appointments left her anxious and exhausted. She had undergone a colonoscopy, a PSA test for her husband, and a cardiac stress test recommended by her cardiologist. Although she was healthy and active, she was now facing additional procedures because of borderline results. Eleanor's daily life had been disrupted. Her morning walks were replaced by appointments. She felt constant fatigue from stress, and she worried about potential complications. Together, we reassessed her overall health, daily routines, and personal priorities. We created a plan that emphasized observation, targeted lifestyle adjustments, and strategic monitoring rather than immediate invasive interventions. Over the next few years, Eleanor maintained her independence, energy, and peace of mind, avoiding the complications her friends experienced when they followed routine recommendations without question. These stories highlight a key truth. More testing is not inherently better. Thoughtful assessment, individualized care, and a focus on meaningful outcomes often provide the best path to healthy aging. This principle is reinforced by research. Large-scale analyses published in journals such as the New England Journal of Medicine and JAMA show that the benefits of routine screenings tend to diminish with age while the potential harms increase. Evidence suggests that around 75, the balance between risk and reward begins to shift significantly. Recognizing this tipping point is crucial for patients who want to maintain health, independence, and a high quality of life. International comparisons provide further perspective. In countries like the United Kingdom, Canada, and Scandinavian nations, screening practices for older adults are more selective. Physicians make recommendations based on individualized assessment rather than following rigid checklists. Despite fewer interventions, outcomes for older adults in these countries are often comparable or even superior to outcomes in countries with more aggressive screening practices. This suggests that personalized care, rather than a higher volume of tests, is key to promoting longevity and overall well-being. With these lessons in mind, it becomes clear that avoiding unnecessary tests is only part of the equation. Equally important are the daily habits and lifestyle choices that directly support cardiovascular health, mobility, cognitive function, and overall resilience. Moderate, consistent physical activity is one of the most powerful tools for older adults. This doesn't mean training for a marathon, though some do, but incorporating walking, light resistance exercises, and flexibility routines into daily life can dramatically improve independence and vitality. Physical activity supports heart health, preserves muscle mass, enhances balance, and helps maintain bone density. Nutrition plays an equally crucial role. A balanced, nutrient-dense diet, rich in lean proteins, colorful vegetables, whole grains, and healthy fats, supports energy levels, cardiovascular health, cognitive function, and immune resilience. Hydration is essential for every system in the body, particularly in older adults, where dehydration can occur more easily and have more severe consequences. Sleep, too, is a cornerstone of healthy aging. Consistently restorative sleep strengthens memory, emotional regulation, and metabolic health. Social engagement and a sense of purpose are often overlooked but profoundly impactful. Humans are inherently social beings, and older adults who maintain strong social connections report higher levels of life satisfaction, better cognitive performance, and lower rates of depression and anxiety. Whether it's weekly visits with family, participation in community groups, or volunteering, These connections provide emotional support and contribute to long-term well-being. Natural supplements and targeted nutritional support can complement these lifestyle habits. Compounds such as L-citrulline, found in watermelon extract, may enhance circulation and cardiovascular function. Specialized senior vitality formulations combining vitamins, minerals, and plant compounds can provide additional support for energy, immunity, and overall wellness. While supplements are not a replacement for healthy routines, when used strategically and under professional guidance, they can serve as valuable adjuncts to a comprehensive health plan. Another important consideration is mental and cognitive health. Cognitive resilience doesn't happen automatically with age. It requires deliberate engagement. Activities that challenge the brain, such as puzzles, learning new skills, or exploring new hobbies, can preserve memory and mental acuity. Even small daily practices, like reading a book, journaling, or engaging in meaningful conversation, can make a significant difference over time. The psychological impact of unnecessary testing also deserves attention. When older adults undergo a cascade of tests and procedures, the stress and anxiety can be substantial. This psychological burden often affects sleep, mood, and daily functioning. In many cases, the mental health impact of overscreening is as significant as the physical risks. Creating space for mindful decision-making, reflection, and personal choice is a key part of supporting overall well-being in older adults. Patient stories consistently illustrate these principles. Take Mr. David Lin, 76, an avid painter and retired teacher. During a routine checkup, he was advised to undergo a full suite of screenings, including colonoscopy, PSA testing, and cardiac evaluation. Rather than proceeding automatically, David asked detailed questions about the necessity, risks, and potential outcomes of each test. With guidance, he focused on lifestyle strategies, daily walks, a nutrient-rich diet, and social engagement through local art groups. Over the next several years, he remained active, mentally sharp, and independent, avoiding unnecessary medical interventions and their potential complications. Contrast David's story with that of his friend, Thomas, who followed routine recommendations without question. Thomas underwent multiple procedures, experienced complications, and saw his quality of life decline as his daily routines and independence were disrupted. These real-world examples underscore a crucial truth. Health is not simply defined by the number of tests performed, but by the quality of decisions, daily habits, and the ability to maintain independence and meaningful engagement in life. While David and Thomas's experiences illustrate the impact of personal choices and unnecessary testing, there are countless other stories that reveal how subtle medical decisions can shape quality of life in older adults. Take the case of Mrs. Sylvia Moreno, 77, a retired librarian with a passion for gardening and birdwatching. Sylvia had always been active and healthy, enjoying her hobbies and social gatherings with friends. During a routine visit, her physician recommended a series of screenings, including a colonoscopy and cardiac stress test. Although she felt perfectly well, Sylvia hesitated and asked her doctor about the potential risks versus benefits. Together, they reviewed her health status, daily activity, and personal goals. Sylvia decided to postpone the colonoscopy and cardiac stress test, opting instead for regular monitoring, maintaining her exercise routines, and adjusting her diet slightly to support heart and digestive health. Over the next 5 years, Sylvia remained fully independent, physically active, and mentally sharp. Her story is a testament to the power of intentional, informed decision-making, showing that patient-centered care often produces better outcomes than blindly following routine protocols. Meanwhile, some of Sylvia's friends, who underwent similar screenings without question, face complications. Hospitalizations after colonoscopy prep, stent placements following stress tests, and ongoing medical interventions that limited their mobility and independence. Another example is Mr. Henry Dawson, 76, a retired engineer who lived alone and cherished his morning walks and volunteer work at a local community center. During a routine checkup, he was advised to undergo PSA testing, colonoscopy, and an aggressive cardiac evaluation. Concerned about potential side effects and the disruption these tests could cause to his daily life, Henry decided to consult with a geriatric specialist. Together, they assessed his overall health, risk factors, and life expectancy in a personalized way. Henry focused on lifestyle interventions, moderate cardiovascular exercise, strength training, and a nutrient-rich diet, alongside mindfulness practices to reduce stress. Over time, he maintained his independence, avoided unnecessary procedures, and remained engaged with his community and hobbies, demonstrating that proactive yet cautious health management can be highly effective in older age. These examples highlight an important point. While the medical system often promotes routine screenings and interventions, individualized assessment is essential, especially after 75. Evidence from large-scale studies consistently shows that the potential harms of routine screenings increase with age. For example, research published in JAMA Internal Medicine found that older adults who underwent routine colonoscopies beyond age 75 were more likely to experience complications than survival benefits. Similarly, studies on PSA testing in men over 70 revealed that while a significant portion showed elevated readings, the majority of detected cancers were slow-growing and unlikely to impact lifespan. Yet interventions often introduced unnecessary side effects and anxiety. Cardiac testing shows similar trends. A review of asymptomatic older adults undergoing stress testing found that false positives were common, leading to additional procedures, stent placements, and, in some cases, major complications. Importantly, these interventions did not consistently improve survival rates compared to conservative management strategies, including regular monitoring, lifestyle adjustments, and medication management when indicated. Taken together, this research underscores the importance of tailoring healthcare decisions to individual health status, age, and personal priorities. International comparisons provide further insight. In countries such as Sweden, Denmark, and the United Kingdom, older adults are screened selectively rather than routinely. Physicians assess overall health, comorbidities, and personal goals before recommending tests. Despite fewer interventions, outcomes are often as good as or better than outcomes in countries with more aggressive screening practices. This approach emphasizes that thoughtful, personalized care, not simply more testing, promotes longevity, independence, and quality of life in older adults. Lifestyle habits remain central to these outcomes. Physical activity is one of the most well-documented predictors of healthy aging. Regular walking, resistance exercises, and flexibility routines improve cardiovascular health, preserve muscle mass, enhance balance, and maintain bone density. Even light, consistent movement can dramatically reduce fall risk, which is one of the most significant threats to independence in older adults. Exercise also supports mental health by reducing anxiety and depression, improving sleep, and boosting cognitive function. Programs that combine aerobic, strength, and flexibility training have been shown to provide the greatest overall benefit. Nutrition is equally critical. Older adults benefit from diets rich in protein, fiber, healthy fats, and antioxidants. Lean proteins support muscle mass, which naturally declines with age, while fiber and plant-based nutrients promote digestive and cardiovascular health. Omega-3 fatty acids, found in fatty fish, nuts, and seeds, can support heart and brain health, while vitamins such as D, B12, and calcium are essential for bone and neurological function. Adequate hydration is often overlooked, yet it is vital. Dehydration in older adults can contribute to cognitive decline, urinary issues, and increased risk of hospitalization. Mental and cognitive engagement is another key pillar. Activities that challenge the brain, learning new skills, reading, puzzles, or creative pursuits, enhance cognitive reserve, helping maintain memory and problem-solving skills. Social engagement, including community involvement, volunteering, and meaningful relationships, has a direct impact on mental health, life satisfaction, and longevity. Older adults who maintain strong social networks tend to have lower rates of depression, better cognitive performance, and higher overall life satisfaction. Stress management is equally important. The psychological burden of unnecessary testing, false positives, or interventions can affect mood, sleep, and daily functioning. Mindfulness practices, meditation, deep breathing, or even simple hobbies like gardening can help reduce stress and improve resilience. When combined with exercise, nutrition, and social engagement, these practices create a holistic foundation for healthy aging. Supplements can serve as a thoughtful complement to lifestyle strategies. For instance, L-citrulline, found in watermelon extract, may support circulation and cardiovascular health. Senior Vitality formulations containing vitamins, minerals, and plant compounds can support energy, immunity, and overall wellness. While not replacements for healthy routines, these supplements can provide additional support when used strategically and under professional guidance. Patient-centered decision-making also involves asking the right questions. Older adults should feel empowered to ask physicians about the necessity of recommended tests, the potential risks and benefits, and alternative approaches. Questions such as, "What happens if I wait?" or "Are there non-invasive ways to monitor this condition?" can open important conversations that prioritize quality of life and independence over routine protocol. Informed patients often make choices that align better with their personal goals, avoid unnecessary harm, and maintain both autonomy and dignity in the aging process. Consider the story of Mrs. Louise Carter, 79, a retired schoolteacher who loved hiking and spending time with her grandchildren. Louise had been advised to undergo a series of routine tests, including a colonoscopy, PSA screening for her husband, and cardiac evaluations. Concerned about the potential risks, she consulted a geriatric specialist who guided her through an individualized assessment. Together, they weighed her overall health, activity level, and personal priorities. Louise opted for selective monitoring, focusing instead on daily exercise, a nutrient-rich diet, and social engagement. 5 years later, she remains fully independent, active, and socially connected, enjoying her hobbies and family life without the disruptions and risks that often accompany routine interventions in older adults. As we've seen through the stories of David, Sylvia, and Eleanor, the decisions we make or don't make about medical testing in older age can profoundly shape our quality of life. But beyond careful choices about screenings, everyday habits play an equally important role in healthy aging. Physical activity is perhaps the single most influential factor. In addition to lifestyle habits, the most powerful tool for older adults is informed decision-making. Asking questions like, "Is this test necessary at my age?" or "What are the risks and benefits in my specific situation?" helps ensure medical care aligns with personal priorities. Decisions should be guided by context, age, overall health, activity level, and goals for independence. Patient-centered conversations with healthcare providers often prevent unnecessary procedures while supporting both safety and quality of life. Research supports these strategies. Studies in journals such as JAMA and the New England Journal of Medicine show that benefits of routine screenings often decrease with age, while potential harms increase. Internationally, countries like Sweden, Canada, and the United Kingdom prioritize personalized assessment over rigid screening checklists. Outcomes for older adults in these regions are often as good as, or better than, those in countries with more aggressive testing protocols. These findings underscore that longevity and quality of life depend more on informed, individualized care than on the sheer number of tests or procedures performed. As we wrap up, the central message becomes clear. Healthy aging is defined not by the number of procedures performed, but by the quality of daily choices, awareness of medical decisions, and active engagement in life. Exercise, nutrition, cognitive stimulation, social connection, stress management, and thoughtful supplementation form the foundation. Informed decision-making about screenings and medical interventions ensures that actions taken genuinely support well-being rather than introducing unnecessary risk. Ultimately, the goal is to maintain independence, preserve vitality, and cultivate joy in daily life. Older adults who ask the right questions, evaluate risks in context, and prioritize habits that support physical, cognitive, and emotional health often experience better outcomes than those who rely solely on routine interventions. By integrating lifestyle strategies, informed medical decision-making, and personal reflection, individuals can take control of their healthcare journey, minimize unnecessary harm, and maximize quality of life for years to come.